I'm John Hogness. I used to be the dean of the medical school at the University of Washington and later the president of the university. I was dean of medicine that the school was really born. Tom Grayston and I had known each other. We went to the same medical school at about the same time. I happened to have been a couple years ahead of him, I think, but he and I had been friends, and when I was dean of the School of Medicine, he was chairman of the Department of Community Medicine. I think it was called something in Community Medicine. What?
The Department of Preventive Medicine.
Oh, is that what it was called? I'd forgotten. Anyhow, we had been talking for some time about the possibility of creating a school of public health rather than just a medical school department. And since there was no school of public health and still isn't, this side of Minneapolis and north of San Francisco. So there was a federal grant program which came up, and which was for public schools of public health. But the money, which was considerable, as I remember, somewhere around $600,000 or something, but that could be wrong. At any rate, that was available only to schools. It was not available to the equivalent entity as a department, which ours was then in the medical school. So we, for that reason, but much more important than that, because we felt it was very important to expand the level of involvement of our faculty in public health, we felt that it was time to create a school. So when he as one of the chairmen, where I was dean, and I, this of course the impetus came primarily from Tom, we decided to go ahead and move toward the creation of a school of public health. Now, obviously, it didn't happen overnight, and by the time it was finalized, I was executive vice president of the university. That was I had left the deanship, but Tom and I have been close friends. Were at that time and have been ever since. We were fishing buddies for many years. Tom and Bob Petersdorf, who was shortly after the School of Public Health was founded, became chairman of the Department of Medicine. And he and Tom and I used to go fishing out at Nia Bay every year, every September, and we had a very good time there. Tom is a great fisherman. Not only salmon, but he's even more dedicated to trout fishing and steelhead fishing, I think. And he still is, and I haven't done much fishing recently, but we had great times out at Nia Bay, catching and cooking salmon. Tom would always cook the salmon, and I would always make the coleslaw and other things. Petersdorf would always wash the dishes. We never trusted him to do either that or drive the car. Tom and I drove the car towing the boat out to Nia Bay, but we wouldn't trust Petersdorf to either drive the car or do any cooking, and he didn't particularly want to. He was an equally close friend to all three of us were good friends. But those were great days, and actually, somewhere around 1985 or so, my wife and I built a cabin over in Mazama in the Methow Valley, and Tom and Nan came over to visit us one time, and they liked it so much they immediately looked for a piece of property and bought a piece of property and built a house just less than a mile from where we were. So they still go over there a good half the time, I think, if not more. Since I've moved in here to University House, I'm not able to use that place anymore. So I sold mine, but it's my house. Margaret and I sold our house. But Tom and Nan are still there, and they love it over there. And he can do a lot of fishing in the Methow River, which he does.
Gil Oman was another leader of the school that you had a chance to work with. Wonder if you could give us your thoughts on Gil.
Well, I knew Gil well, too, not nearly as well as I knew Tom. Gil was one of the brightest men I've ever met. He's extremely sharp. He was. I was not president while he was dean. I had left the presidency in '79. By the way, Tom, when I was president, had become vice president for health affairs. Shortly after I left the executive vice presidency to go back to the Institute of Medicine at the National Academy of Sciences. Then Tom became vice president for health affairs and was for quite a while. One thing before I get back to the other people is I wanted to mention about Tom, which is really quite remarkable. He had major administrative positions as chairman and as dean and as vice president, but he always maintained his research lab, which is unusual for someone who is a vice president, for example, or even a dean. Deans usually give up their research just because there's so much to do. But Tom had always maintained his research lab and actually got back into research after he left the vice presidency and did more, I think, at least as much, if not more, good research during and after he became vice president, at least as much as he did even before. So that's quite remarkable and quite unusual. And he, up until just about a year ago, or maybe he's still fiddling around because they're ending up a major research program which was done throughout the United States with a number of partners, and on chlamydia, and he was principal investigator for this large, I think it was a $11 million project, and they've been very active and very productive in research as well as a great administrator. So I have lots of good things to say about Tom.
Shall we get back to talking about Gil?
Well, I know Gil presently, or at least very recently, was president of the American Association for the Advancement of Science. But he when he came here as dean, as I said, he was a very sharp man, very smart man. He added many new dimensions to the school, particularly I think in the genetics area, and I think he was highly regarded around the university. He is a very sort of, I would say, a positive personality, and Gil has never tolerated fools, and his definition of fool is not always mine, but nevertheless, he was very bright, and so was his wife. So, and he went on to University of Michigan, where he did an excellent job. As far as I know, he did a great job here. I wasn't here most of the time he was dean, but he was very productive, and certainly the school grew enormously when he was here, and developed. Well, it already had even in its early years, had a very good reputation when Tom was dean. Really quite surprising. And Gil was more of a medical geneticist, among other things. He also a great piano player, a classical piano player. I don't know if you knew that, but
I didn't.
Yeah, he's really a very accomplished piano player. And, so we have a great deal of talent in this university, and in people like Gil and Tom.
Very well-rounded. One of the comments that comes out of these interviews is that there was something special at the University of Washington that people who had gone to school at Stanford and Harvard or taught there did not find to be so. And that was a cooperation, a collaboration, an interdisciplinary collegiality. And that was something that you must have witnessed.
That's right. It's true that we have had all over through the years, a great sense of cooperation in the School of Medicine between the clinical sciences and the basic medical sciences. As a matter of fact, it was really not a very difficult thing to pull off, to separate a department from the medical school and make it a school of public health. In some institutions, that would have been like pulling teeth. In this institution, it was not difficult. In fact, one of the great strengths of this school and of the School of this School of Public Health and of the School of Medicine is the fact that the two schools work closely together. And witness the recent creation of the Department of Global Health, which is a joint department between the two schools. That does not happen in every university in the country, and that is just an outgrowth, I think, of the real sense of cooperation and desire to work with other people that's been in this institution and in the health sciences, particularly since they were created. Same applies to nursing, the relationship between medicine and nursing, and public health and nursing, pharmacy, dentistry, and so forth.
Another strength of the school is the choice of leaders, people who were not self-aggrandizing, people who were eager to bring on the talent that they had, people who served as mentors to younger faculty members. Your comments?
Well, that's true. They're also just basically nice guys and gals. And one person that comes to mind is Ed Perrin, of course, who was just a wonderful person. Also, had a lot of experience, and he was very well liked by his entire faculty. Interestingly, my oldest son, whose name is Eric, he calls himself Rustin now, but his name is Eric, went to work in Ed Perrin's department while he was in his junior and senior years in high school as a computer programmer. And so Ed still asks about him, and my son asks about Ed all the time, and they're still a fond, warm relationship there. So Ed did a great deal to encourage Eric, or my son Eric, to move on into. Actually, he went into the history and philosophy of science, but Ed had something to do with that. So I'm very, very fond of Ed.
You've described the remarkable relationship between the School of Public Health and the School of Medicine. I wonder if we could end this interview with you looking to the future and giving us some further thoughts on the Department of Global Health.
That's a brand new department. King Holmes is, of course, a superstar in some ways, in many ways, but I don't know him well. I was around when he was here, but our paths never crossed very much. But I've always heard wonderful things about him, and I know he's going to be a great chair of that department. It's a very important department, and it's unique, but it's still very young, and what it becomes will depend on people like King Holmes, but you don't have to worry too much that it's going to be a good one if when you know that King is going to be chairing it.